Health Care Act. Some people are calling it Trump Care, some people are calling it Ryan Care. So our concerns... We don't care. Or nobody gets care, it sounds like, after the CBO score today. So we were told for the last 6 years the Republicans hated the Affordable Care Act and they wanted to get rid of it. And then they kind of said they would replace it with something, but they haven't shown us anything for 6 years, which is a little odd. But, you know, as we learned a couple weeks ago, this is tough stuff, right? Who knew to put together this? So the Republicans then... the last couple months, I guess, came from just getting rid of it to they were going to try to replace it or repair it, and then it goes to replace, and then they had some other language. But they knew they had to do something. Now, the good news is, in my opinion, I am a silver lining person, but the good news is there are now certain standards that are completely cemented in how we look at healthcare. One is that if you're sick and you have a pre-existing condition, you now have access to healthcare. Everyone now... not everyone, but generally, everyone now agrees with that. That adult children stay on their parents' policy until they're 26. That you don't have a lifetime cap. If you're sick and you need health care, you don't have a cap. There are now some general-isms that are out there that I think are really valuable. In that now, I think instead of... there were times that I thought, you know, health insurance was profit insurance, right? If you didn't cover people who are sick and you just cover people who are healthy, well, that's a great way to make money, but it's not really health insurance. And now we finally got some really good standards in because of that. So that's tremendously valuable. And I will also say that there were some problems that we needed to clean up with the Affordable Care Act. Actuarially, if people who are healthy and didn't sign up, that's what that's why they were supposed to do it, but there was a penalty through the tax policy. If they didn't do it, and the penalty wasn't all that significant, a lot didn't, you have an actuarial imbalance to the system. We found 20 million people signed up, so people got access to health care. And I saw a couple earlier from Spring Green I was talking to outside. When I was in Spring Green, Main Streeting, 3 years ago, I think it was, I went to one business, and I won't say who it is in particular, and I started talking to one of the proprietors, and she called her husband down and said, I just want you to know that we haven't had health care until the Affordable Care Act finally came around. And now we have health care. And I think what we've learned is 20 million people needed it and got access to health care, and we helped level a lot of the cost increases for a long period of time until this last year. We've had that happen out of the Act. So a lot of good things came out of it, but we have to recognize there were some actuarial problems, that if healthy people didn't sign up, there was an imbalance. We probably needed a public option. It didn't happen when the bill passed. I wasn't there at the time, but that's something that would have been really important. In the Senate, it didn't happen at the time. But there are things you can fix and still keep what the Affordable Care Act is. And what they're coming in doing now is really, I would argue, more of a tax cut for the wealthy bill with a side of health care than a health care bill. Because for the wealthiest, this is a huge tax cut. In fact, hand me my folder. I'll make sure I'm saying the right numbers so I don't say it the wrong way. But the actual tax cut itself, if I can find it quickly and easily here. Give me 1 second. I apologize. I don't have it off the top of my head. I'm gonna miss it, but it's a huge. It's in the hundreds of millions of dollars. $600 million, and specifically for the top 1%, I mean, they're seeing the vast majority of the tax cut. Now, what's going to happen under their new plan, so a lot of wealthy people are paying less taxes. That's the revenue that paid for all those things that you have. They're going to basically offer a plan that is either going to be unaffordable, even though they're still going to offer plans that take care of pre-existing conditions, you're probably not going to be able to afford it. And what we said all along is we were afraid that fewer people would have health care out of this in the end, and that people would be paying more for it. And what we found is exactly that. So not just from the analysis through the committees last week, if you're an older American, and I'm close to the older American category I'm talking about, you could be paying 5 times more than someone who's younger, and that wasn't part of the old plan and shouldn't be. The subsidy isn't going to happen anymore so that you can have a subsidy to afford the plan. It's going to happen now by age, by age rather than if you actually need it. to buy health care. So the CBO score was really important. And last week when it became before 3 committees in Congress, we said, how can you be rushing this? No hearings whatsoever. We had like 70 hearings in the House on the Affordable Care Act. Hundreds of hours of debate. So they had 2 committees, and then this week it's the Budget Committee, and next week it's supposed to be on the floor of Congress because they want to do it before break. That's all they're saying. They want to do it before the break. Well, now we got the CBO score today, and it said 24 million people will lose coverage with the plan. And there's a reason why they're rushing it, because they probably know that. And they said there'll be more parts coming. You'll be able to buy health insurance across state lines. You'll be able to put money into a health savings account. Almost all these things are good for people with a lot of money, but they haven't really been proven to do much about healthcare costs. So fewer people will have health insurance, more people will pay more for health insurance, and in the end, what the bill's probably really about is the wealthiest get a huge tax cut. So this is a terrible, terrible bill. And there are a lot of Republicans, 7 Republicans. Oh, and it cuts back Medicaid drastically to states, and so that means fewer people who actually can't afford and need health care won't have access to it. My sister-in-law works at a hospital, and she says how people come and say, their biggest concern are, one, can I get cured or whatever happened? Second, how can I afford this? Right? Those are the concerns you have, and you're going to have people who aren't going to have access because of that. So we're doing everything we can to continue to highlight this, to fight it. I think 7 Senate Republicans already said that they can support because of those cuts to Medicaid alone, because more people in their state that lose access. And Tom Cotton, a senator from somewhere down south, I think it's Arkansas. All right, he used to be in my house. He was in my class for like a millisecond, and then he went to the Senate. He has even said, and he is not a liberal, and he is not a moderate, and he's not even a conservative, has said that this will not pass the Senate. So if there is no chance that the Senate's going to do it, there's going to have to, I don't think this will become law per se, but they're going to start moving this through with the budget reconciliation process to get fewer votes in the Senate to try to make sure it passes. Even if they do their phase 2 and 3, it's not going to pass. So I think what we're finding is they realize they're going to have a harder time than they thought, but I think Paul Ryan is going to push really hard for these tax cuts that are supposedly a health care bill. So we're just going to have to be really on top of this. I mean, and the CBO said all of us are going to pay more for health insurance, especially up to 2020, and then there might be some bends after that. But you're going to be paying more for health insurance. And I would argue, especially when you find people don't have health insurance, what's going to happen is you go to the hospital, and the hospitals now are going to go back to having to pay for the care, like here, in Baraboo, and that's going to mean you're going to have additional costs because of that. So we're definitely going to have increased costs out of all this. Yes?
What about the things that don't get talked about that are affected by the repealing Obamacare, like effects on Medicare? Or the other day, I read that in the Washington Post that this is going to cut about $9 billion a year to the CDC, so that they won't have any money to use on vaccinations, preventive care, things like that.
Yeah, so what I would recommend, here's a piece I'm looking at. It doesn't say the publication. I'm apologizing on this. I'm going to hand this to someone from staff. Maybe they can tell me what publication this came from. It's a great side-by-side comparison of the current law and under the Republican proposal that's out there right now. I can tell you the authors are Noam Levy, Levey, and Kyle Kim, but I don't know the publication. So if maybe someone in my office is listening, they can tell me what publication that came from. That's one of the best articles I saw, and give you. There are a lot of other things. I'm just giving you the top lines, but I think today the fact that 24 million people are going to lose coverage by the nonpartisan, what we all go to for what's called scoring, to tell us what the effect of a bill is going to do, especially both financially and in something like losing coverage. That alone says it's not a health care bill, right? I mean, if anyone still calls this, I hope we come up with a nice, catchy acronym soon for this, because it's not about health care anymore. This is about tax policy for the wealthiest, which is something I've watched Paul Ryan and the Republicans try to do since I've been in Congress. They're just masking this in health care. And we're going to have to do everything we can to fight it. So let me here and here.